number one characteristic that you need to have as a medical student or someone going into medicine. And if you really, really want to be a doctor, don't give up if you don't get in the first year. Going to medical school to be a psychiatrist and coming out a surgeon on the surface seems about as 180 of a flip as you could have.
Welcome to Oceanside Perspective and our new series, Finding Purpose, where I speak to professionals who have found their passion and want to share their unique journey, experiences, and learnings with our audience. I'm here today with Dr. Damon Herr, a previous guest on the podcast and general surgeon at the Kaiser Permanente Sacramento Medical Center for the past 23 years. Dr. Herr, thank you for taking the time to have this conversation with me today.
Oh, my pleasure.
I want to start off by talking about how we know each other, because I think it's an interesting story and a bit unconventional. As many of you know, my mom, the founder of OP, was diagnosed with breast cancer early last year. And during the most uncertain time of our lives, Dr. Herr was the first doctor we saw that after her diagnosis. Going into the appointment, I had no idea what to expect, other than what most people would consider to be the stereotypical surgeon, who's not exactly known for their soft skills and bedside manner. So it was such a pleasant surprise to meet you, Dr. Herr, a surgeon who's humble, a good listener, an excellent communicator, and an expert at your craft. After my mom and I went through the whole process of surgery and treatment, you agreed to be on our podcast and kindly offered to let me shadow you. You're my very first shadowing mentor, who I've been following around for the past few months. It's truly been a whirlwind experience, and isn't it amazing to think about how far we've come since last year?
Right?
Yeah. So much has happened.
That is true.
So let's start by talking about your personal journey to medicine. Could you briefly introduce your background and how you got to where you are today?
Well, I'm California native, grew up mostly in the Bay Area, but have lived in other parts of California and other states, but mostly grew up in the Bay Area. I don't really have any medical care providers in the family, and not really any college graduates either. But I always did well in school, and my parents used to joke that one day I'd either be a lawyer or a doctor. I went to college because I was supposed to. That was the expectation. At one point in time, I realized I was really intrigued by psychology, and so I actually declared my major in psychology, and so my intent was to get a bachelor's degree. And then when I started thinking about what I would do afterward, I started to realize that I didn't really want to just be a therapist. I wanted to be a psychiatrist. And that, of course, meant going to medical school. So that made college last a little longer while I did all of my pre-medical requisites. And then when I finished, I applied to medical school. And the first year that I applied, I did not actually get in. I was a little naive in the process and only applying to a few schools on the West Coast. And I didn't realize I really needed to kind of expand my net. And I also needed to make myself a better candidate. So I did some additional volunteer work. I did some additional like graduate level courses in neuroscience and things like that. But one of the things I did during that time, though, was I took training and I worked in Santa Clara County as a suicide crisis counselor. So I actually, for a year, would spend shifts waiting for someone to call who was in crisis, and then talking to them and trying to help them through this sort of desperate moment. The second year round, when I applied to medical school, I got accepted a couple of places, and I ended up going back east to Howard University. Partly that was because I'd been accepted to a few programs in that area, and my wife also needed to transfer school, and so we settled on the DC metropolitan area. She went to the University of Maryland, and is where she transferred. And then, so I started medical school thinking, hey, I want to be a psychiatrist. And as I got through the first 2 years of non-clinical stuff, and I started to get exposed to the actual practice of psychiatry, I started to realize that it wasn't exactly what I thought it was going to be. And I got exposed to surgery. I was fortunate enough to do a summer fellowship with our chief of surgery after my second year. And then my first clinical rotation as a third-year medical student was general surgery. And I was just completely hooked. I abandoned the idea of becoming a psychiatrist, and I basically abandoned the idea of doing anything else other than becoming a surgeon at that point in time. And so I finished medical school. I did well in medical school, and I was able to get a residency spot at Loma Linda University in Southern California, where I did 5 years of clinical training. And then I came to work here at Kaiser directly out of residency, and I've been here ever since.
You studied psychology in undergrad and also worked as a suicide crisis counselor.
Correct.
So what's something that you learned during this time that influenced the way that you communicate today?
I learned to listen. I learned to be comfortable being quiet and being with somebody who's vulnerable or emotional. And I learned to be able to pick up on their emotional cues, their verbal cues, their nonverbal cues, but really just to listen, to like turn off my analyzing them or trying to fix them, and really just sort of take in what they're trying to tell me, right? And I think only when you really listen to somebody can you figure out what it is that you can do to help them get better or get to where they want to be. So definitely learning to just be quiet and listen, and to be okay and to be comfortable in a very uncomfortable situation, especially early on with the crisis hotline stuff. I mean, my goodness, you've got somebody calls on, a complete stranger, you don't know them from Adam, and here they are telling you that they're going to kill themselves or they want to kill themselves. And you have to try to talk them down in a sense, but you talk them down by listening to them. You don't talk them down by telling them things. You need to listen to them. So I learned how to reflect what's been told to me. I learned the importance of empathy, but mostly I learned just to be quiet and listen.
So what exactly drew you to general surgery?
Yeah, great question. So, going to medical school to be a psychiatrist and coming out a surgeon on the surface seems about as 180 of a flip as you could have, right? So what I learned, I learned two things. So there's two things I learned about myself in medical school. The first thing I learned was that you didn't need to be a psychiatrist to practice psychiatry. And what I mean by that is, in all fields of medicine that are involved with direct patient care, you're using psychology and psychiatry every day, okay? How you interact with people, how you understand them, how you feel empathy for them, how you help understand what it is that they really want to achieve, what they're afraid of, what their goals are. It requires the skills of a therapist in a sense. And so I was going to need those skills no matter what I chose in medicine. I realized that the practice of psychiatry wasn't what I thought it was, right? At that time, and this is the late or the mid 90s, psychiatry was make a diagnosis, write a prescription. And success was a patient stable, not cured. And I kind of realized that, like, for my own selfish reasons, I wanted to cure people. I wanted to be able to help them just be better and be done with it. And when I got into surgery, I realized that, number one, I enjoyed using my hands and actually intervening physically, which wasn't something that I thought was going to be important to me. And a surgeon gets to incorporate not only their physical skills, but you have to have a base of knowledge and experience where you can process information, come up with a diagnosis, be able to treat somebody. Ideally, you do it in an empathetic, caring way. And then seeing that patient get better, recover, see that you're done. They're fixed. They don't need you anymore. And that's a good thing, that they don't need you anymore. And be able to say, thank you for trusting me to operate on you and have a great life, and have them go away happy. That was really rewarding, right? So it was more about what, again, selfishly, I needed to be happy as a physician. I found that I really wasn't satisfied following chronic conditions or managing blood pressure medicines or diabetes medicines for a person's lifetime, that wasn't going to really make me happy internally. So I kind of unexpectedly stumbled into what would work for me, and once I did it, I was hooked.
So it took about 10 years-ish of schooling and training to finally become an attending.
Yeah.
What quality of yours do you think contributed to your success?
I mean, getting through medical school was really just, mostly just being good at college, right? If you're, and that sounds funny, but there are some people who are just very good at being students, right? You understand how to take notes, you understand how to kind of know what's important, you're good at taking tests. All residency is hard, but Surgical residencies in particular are grueling and long. I mean, I decided it's what I wanted, and I just wasn't going to not finish. That being said, there were times during residency where I felt like quitting. Yeah, especially early on. Actually getting through it though, what was vitally important was having a support system. And my support system was my wife. So I was married long before I got to medical school. In fact, she was finishing her nursing degree and went on to work at Johns Hopkins while I was finishing my medical school at Howard University. And so we were together for a long time. We complemented each other, meaning what she was strong at, I was weak at. What I was strong at, she was weak at. So we were kind of like jigsaw pieces. We really complemented each other that way. We were both driven. I mean, that's really the reason I got through it. It wasn't all, I didn't do it by myself in a vacuum. I did it because I was part of a very important team, and that was with my wife.
To give some advice to aspiring physicians, how does someone know that medicine is the right path for them?
So you hear sort of I always knew I wanted to be a doctor, and I guess there are some people like that, who from a very early age have sort of identified that that's their path. That wasn't me, right? I had no ambitions of becoming a physician when I went to college. It wasn't even on the radar. If you're not like totally committed, like I can't see myself doing anything else, then I think you need to take a hard look and ask yourself, is medicine really what I want to do? And you can be in medicine and not be a doctor. I mean, there are other pathways to be a professional in the medical field. You can be a nurse, you can be an advanced practice nurse, you can be a physician's assistant. You can be a nurse, then a certified registered nurse anesthetist, and do anesthesia and surgery. You have to want to take care of people, right? If you're going into medicine just for the science aspect or because you think it's cool and your heart's not on, I'm doing this so that I can help people ease suffering, I can cure disease, I can help make the quality of someone's life better, then you probably don't have the right focus for going into medicine. You need to truly understand what you have to do just to get into medical school, especially nowadays. My God, it's incredibly difficult to get in. The expectations of what students have to achieve to get into medical school is just ridiculous.
So speaking of the challenges of getting into med school these days, what qualities or experiences do you think med schools are looking for in applicants today that might set them apart from others?
You do as best as you can academically. You take the MCAT seriously because they do use that as a screening test, whether you're going to get interviewed or not, and you need to score well. I think you need to be as complete of a person as you can be, meaning any interests you have outside of just your drive to medical school make you more attractive. You've done volunteer work, you've done research, maybe you've even been lucky enough to publish something or be a co-author on something you did in grad school or whatnot. All of these things just make you a more rounded candidate, but then you have to sell yourself. So you need to express your desire to be a physician in some way that stands out, in some way that makes the applicant reviewer look at this and go, we want this person here. This person wants to be a doctor so badly, they have so much to offer, we want to give them a chance. But that's different for every school. What does that particular school want? What is that admissions officer going to read in your resume that makes them offer you an interview over somebody else? And the thing is, nobody really knows. I've seen students with above 4.0 GPAs, and every box you can think is marked on the resume, right? And get hardly any interviews or maybe get an acceptance at one place, right? I think the average matriculant to medical school right now is like 27. I think medical schools are really looking for people who have almost already had another career, like people who have done something other than just school. But what I would tell the applicants is this: apply broadly. The other thing is, don't ignore DO programs. DOs teach the exact same curriculum. DOs put out doctors who are fantastic. In fact, here at my facility, probably our top orthopedic surgeon's a DO, our recently former chief of anesthesia is a DO. What it does mean is that for candidates who are maybe not quite as strong in terms of their academic performance, but are driven, the bar for a DO school is still lower. Now it's gradually getting as high as a med school, but you still have a better chance of getting into a DO program than an MD program. You only need one school to accept you. Once you're in, right? Then it's all on you. And if you're good enough to do it, you'll do it and you'll succeed. So don't be afraid of being rejected, cast a wide net, and don't be afraid to ask questions like, what do I need to do to get into your program? What do I need to do to be a better candidate? And then do it.
I know we talked about this a little bit, but how much do you think luck plays a part in this process?
There is no luck involved in being the best student you can be, right? That's your hard work and your innate ability, right? But there is some luck in how you get seen by other people. The thing is, you can't control that, right? So you can't think of it as, I'm lucky, I'm unlucky. You have to think of it as, did I do everything I could do to give myself the best opportunity to succeed?
What's one thing that you would want people to know before choosing to specialize in general surgery?
Once you get into medical school and you start to do your clinical rotations and you get exposed to pediatrics and obstetrics and internal medicine and pathology and radiology and surgery and surgical subspecialties and psychiatry, you'll learn pretty quickly, like, hey, I like this. Do I like the material we cover? Do I like interacting with the types of patients you get? When you look at what is the day-to-day life like for that kind of physician, does that fit my idea of how I want to be? But if you're thinking about going into surgery, you definitely need to be able to say, I don't think I'll be happy doing anything else. And you need to ask yourself, am I willing to go through 5 to 8 years of residency, because some programs require you to do research. So you could be looking at 10 years of training after med school before you even start practicing. The other thing I would say is, when you're in medical school and you're doing these rotations and you take call with the residents, talk to them. Ask them what their life is like. Ask them why they chose what they chose. Ask them, what do they regret about it? What would they change? Would they do anything differently, right? And really kind of get that inside nitty gritty so that you understand what you're going to get into.
So moving on into your working life as a general surgeon, what's your favorite or most satisfying part of your job?
Being able to establish trust, being able to counsel them, being able to take them through the process of allowing me to do something that's very personal and intimate to them, to operate on somebody. Basically asking me to take their life in my hands a little bit, getting them through that, getting them recovered, seeing them recover function, seeing them be cured, seeing them be able to accomplish the goals that they wanted for themselves, and then just having them look me in the eye and say thank you. I mean, that's a very humbling and incredibly satisfying moment. There's nothing worse in surgery than having a bad outcome, having a patient with an unintended, unexpected complication, having to give a bad pathology report. That can be soul-wrenching. And as a surgeon, as a physician, you always look at, could I have done something differently? Did I do something wrong? Did I miss something? Can I be better the next time? And that's continuous improvement, which all physicians do. And we tend to be our own worst critics as well, especially in surgery, I think.
How do you maintain work-life balance, specifically balancing work and family and work and health?
I would say an average week for me is maybe 52 hours, and if I'm on call a couple times in a week, I could be working 70 hours. Now in residency, we always work like 80 to 100, sometimes more than 100 hours a week, so it's not as bad as being in residency. But it does take up your time, and you do have some off hours, especially when you take call. So it's not easy. I will say that I was able to do a pretty good job of it, I think, in my practice, partly because of where I work. I've been with Kaiser my entire career, and in Kaiser we function in a team structure. So in my department, I have colleagues, and we work very well together. We take care of each other's patients so that we can have time off. We're willing to hand off cases on call so that people who've been up all night can get home, and the fresh surgeon can take over and do it. And then just making it a focus, like, even when home and tired, still going and doing the things you need to do for your family, and putting all that aside. So then the one thing that suffers there is personal health, right? So many doctors get burned out. So many doctors are unhealthy because, it's the old, medicine is a calling. It's not your job. It's what you are. And you must sacrifice everything about yourself to help other people, right? That's a little bit campy, and it's a little bit dated. I actually believe that I can't do a good job taking care of somebody else if I'm not at least taking a decent care of my own self. Because if I'm not healthy physically, if I'm not healthy emotionally, how am I going to help somebody else get happy or get healthy physically, right? So you do really need to take care of yourself to do your job fully and correctly. And so you do have to find balance. And I think the newer generations of physicians are better at that. And the organization I work for has really stressed that over the last 10, 15 years as well. And we have all kinds of programs set up to try to help us with that, managing stress, mindfulness, work-life balance, all these sorts of things. So there are tons of resources, but like everything, you have to take advantage of them. You have to make it a priority. You have to make the time to do it. And so it just requires you to commit to it.
So a lot of what I've learned from you ever since the first day or even before that is the importance of trust and rapport, establishing rapport with your patients. What steps do you take to promote healthy relationships between you and your patients? And how do you maintain a healthy boundary while making them feel heard, understood, and cared for?
Yeah. Coming into the room in a timely manner, being professional and kind, introducing yourself, making sure that you pronounce somebody's name correctly, letting them know, hey, I've reviewed everything. I've looked at all the x-rays. I'm aware of the blood tests. I've read your doctor's notes. I'm prepared. I didn't walk in here cold, right? I'm ready for you. And then being quiet and letting them tell their story, right? And I think that part, that letting the patient tell their story, is really important. And then, after you put all it together, synthesize it, try to explain to them what's going on in clear language, let them know what the options are for dealing with it, try to explain to them the pros and the cons, the risks, the benefits, and then shut up again and let them ask questions, right? And make them leave feeling cared for. At the end of the first encounter, I always try to tell them, look, I can't promise you how things turn out. Okay, no doctor can. But I can promise you that I'm going to do everything that I know how to do to take really good care of you, right? And I think just a simple statement like that, like, look, I'm here for you. My job is to help you, and I want to help you. Good communication, I think, is the key for all areas of medicine, in establishing rapport and trust with a patient is good communication skills. Mm-hmm. Not ignoring or minimizing some concern of the patient's, taking it all very seriously.
One thing that you often say is that a hospital is a complex system, similar to the human body, and that it's actually a miracle that things work as well as it does. But there's always areas of improvement. From your perspective as a practicing physician, how do you think the system could work better?
Just pure and simple communication. Doctors to nurses, nurses to patients, housekeepers to nurses, administrators to charge nurses or physician leaders. Real-time communication is like critical for everything to happen properly in a hospital. On a grander, more macro sort of like real world scheme, it's cost. The problem with the delivery of medicine in this country is cost. Medicine is incredibly expensive, and everything operates under tight budgetary controls, and drugs cost a lot and devices cost a lot, and the cost of delivering care in this country is ridiculous. It far exceeds the rest of the world, and we don't get higher health outcomes relative to how much money we spend, right? So we're clearly doing something wrong. There are plenty of other countries in the world who spend way less per capita on healthcare and get better health outcomes by any indices that are used in health analytics. And partly it's because we have access issues and we have cost issues. And not everybody has access to the same level of care. Medicine in this country is a for-profit endeavor. It's a business. And we can talk about, philosophically, do you think healthcare is a right? I do think access to healthcare is a right. But that's not how we practice, in general. We practice as it's a business model. And so it's all geared towards what are all business models geared towards? They're geared towards making profit, right? And so as long as the practice of medicine is purely a for-profit endeavor, then we're going to have problems. Now, people will argue, well, if you have a socialized system or a national healthcare system, then it's run by the government, and then it's going to be even worse, and look at this country and look at that country, and the only way to keep it good is to keep competition, and blah, blah. But the reality is that neither a truly fully capitalist system or a fully socialist system gets it completely right, right? And so there's got to be some kind of hybrid in the middle where we can control costs, we can deliver good across the board care that is consistent from community to community.
So our nonprofit organization, Oceanside Perspective, focuses on our core values of LITE, leadership, innovation, technology, and entrepreneurship, most of which play a significant role in your work, starting with leadership and teaching and mentorship. So what is a quality that you see in your mentees that makes you think they're going to be a great doctor one day?
When I see medical students who are like attentive to detail, who are like driven, they're prepared, they are on it, they're on time, they're hungry, they want to learn, they're taking advantage of every opportunity. And then they show me that I can give them information and in very short order, they're mastering it or they're able to reflect it back, and they can show the ability to take instruction and show progress with their abilities. I think those are important in terms of functionally being a doctor. But I think what makes the best candidates is they just have a passion for taking care of people. They care about people. Like it matters to them. They're not just here, oh, I'm going to be a doctor because I'm going to have this lifestyle and get this paycheck and blah, blah, blah. But they're actually doing it because they have a passion to help people. They care about this complete stranger they just met who's sitting across from them. They actually care what happens to that person. I think that is the number one characteristic that you need to have as a medical student or someone going into medicine. You need to actually give a damn about a complete stranger. If you can't do that, you shouldn't be a physician. You don't have to be a genius. You don't have to be the most technically gifted person. You have to be a good student because that's what it requires to get through medical school. So you have to be good at college. But you have to care. And you have to have the drive to do it. And you do have to be willing to sacrifice a little bit of yourself in order to do that. And I think that's sort of the overarching personality portrait, I would say, of a student or mentee that when I see that, I say they can succeed in this.
So one of Oceanside Perspective's core values is intergenerational learning, where people from different generations exchange knowledge with each other. Many pre-meds, medical students, and residents from various generations have learned from you throughout the years. What's something that you've learned from them? Could you provide an example?
I trained in an era where I think there was this paradigm shift. I think the few eras, generations ahead of me was still very much in this, if you're a physician, it's what you are, it's not what you do, it's what you are, right? And so everything else must be subverted to serve this goal, right? And everything else is sacrificable to achieve this goal because this is this noble endeavor, almost a religious fervor to it, right? And what I've learned more and more as time has gone by, and the young residents and students and whatnot that I've seen, that I've helped train, have really kind of taught me, is how wrong that is, actually. I think. Some people will disagree. It's okay. But I think, hearkening back to what we talked about before, I think you actually have to have balance. The point is, the balance is what keeps you whole. The balance is what gives you the strength to come back and grind, right? If it's all you are and it's all you do, everything is gonna fall away. Your relationships suffer, and then it'll be you and your degrees and all the people you helped, which is great, but everything else that made you is been neglected. And are you truly like a fully realized person at that point in time? Are you your best self? You may have been a great doctor in one sense, but was it a life lived the best way it could have been lived? So I've really learned, I think, the importance of everything that happens outside of the hospital and everything that happens outside of being a doctor, and that it's just as important, if not more important, than what you're doing in your profession is your life outside of your profession.
So in terms of giving and receiving feedback, as a mentor, how do you give feedback that's well received?
I use something I learned from coaching baseball. Both my kids were baseball players. Both played in high school. My oldest one actually played in college as well, almost made it to the pros. And there's this concept called the criticism sandwich. You may have heard of it. Yeah, you're smiling, you've heard of it. So the idea of the criticism sandwich is people don't take criticism well. And if you just tell somebody, oh, you need to change the way you do this, and you need to get better at this, and you shouldn't have done this, all they hear is, I suck and you hate me, especially if they're your kids. So the better way to deliver constructive criticism is to do the criticism sandwich. So the concept is you sandwich a critique between compliments. You've given a constructive criticism in the setting of some compliments, and the person comes away not feeling like they've been critiqued, but feeling like they've been complimented. And they buy into the, hey, coach said, or mentor said, I'm good at this and I'm good at this, and if I work on this a little bit, I'll be even greater. And they feel uplifted by it. They don't feel critiqued, unless they're your kids. Then they take everything you say as criticism. So the criticism sandwich, even when you're talking to a resident, like the resident says, hey, Dr. Herr, what can I do differently? How can I be better? And you say, well, you're really good at this, this, and this. I like the way you do this. I go, you could do a little bit more here and here. I go, but then you also do this and this and this great, and I think you're doing great, and just keep on the way you're doing. Focus on this a little bit, and you're going to be fine. And they don't come away feeling like they've been critiqued. They come away like they've been uplifted instead of torn down. And that's it right there. You got to tear people down to build them back up. Yeah, that works for some people. It doesn't work for most people, right? Maybe in the military that works, but in real life, for most people that doesn't work. Because if you start by hammering them, they tune you out. They stop listening. They make an emotional judgment about you or about how they perceive you to feel about them. And then it becomes about emotion and not about logic, right? So now it becomes, this person doesn't believe in me, this person doesn't like me, then I don't like myself, or I'm not going to listen to them, and they won't hear what you have to say. So again, it's the trust rapport thing. No, I believe in you, and you are really good at this, this, and this. I like the way you do this. This is an area where we can get better, and when you do it like that, I think, and there's lots of studies actually to show this is effective. I think that helps people improve themselves and still feel good about themselves.
Let's talk a little bit about innovation and technology. There are constant changes, breakthroughs, advancements in medicine. How has the industry or the field of general surgery changed since you began working in it?
There are operations we do now that didn't exist when I trained. There are operations that I was trained to do that we never do anymore. How we keep track of everything, electronic medical record, that didn't exist when I trained. When I trained, we were still in the era of everything is paper charted. Now everything's electronic. So that's completely changed everything, and it's a change for the better because it puts so much information at my immediate access. It allows me to do a much better job of taking care of people. So procedures have changed. Some of the procedures have changed because of technology. New devices, new ways of looking at things. When I trained, most of our surgery was done open. Now most surgery is done laparoscopically, so minimally invasive techniques, where we go in with cameras, sometimes even done now robotically, which doesn't mean it's being done by a robot. A surgeon's doing it, but they're doing it at a council, controlling the robot. None of that existed when I was training. We did gallbladders laparoscopically, and that was about it when I started training. And now we do colon surgery, bowel surgery, basically everything in the abdomen can be done to greater or lesser degree laparoscopically. Focus in the hospital about what's important and how we get people in and out of the hospital safely. And there were so many things that we used to do where people would spend days in the hospital, and now we don't even keep them one night. And guess what? They do great. They do fine. They actually do better going home than staying in the hospital. So yeah, practice of surgery has changed dramatically. Another way that it's changed, not necessarily for the better, is the breadth of what a surgeon can do. So when I trained as a general surgeon, when I first started my practice, there were a lot of other areas of surgery that I did that I no longer do because of what we call subspecialization, right? So people do additional specialized training, get additional certification, and then when they come on board, they basically take over that sort of niche. So I used to do thyroids and lung surgery and pediatric surgery, and I haven't done any of that for a long time because it's been subsumed by subspecialists. And the idea of a true general surgeon who does everything doesn't really exist anymore. It was already going away when I finished training, but it really doesn't exist now. Kind of the closest thing to a general surgeon is what we call an acute care surgeon, which is a surgeon who usually is trauma trained, staffs hospitals to take care of emergency type situations. And then maybe in some rural settings, you'll still see general surgeons who do a wide variety of things, maybe even C-sections also.
Do you think AI could eventually replace aspects of your job and change the way that you do patient care?
I don't want to believe, and maybe it's just because I don't want to believe it. I'd hate to think that there's going to be a time when this kind of an interaction isn't still a cornerstone of taking care of a person. No matter how good the AI is, it's still not human. Right? It's as human as we can make it. It'll be human-like. And, for people who grow up, if that's what their experience is, maybe they won't care or notice any difference if that's what they start with. And maybe this is a generational change type thing. And once we're a couple generations past my practice, it won't matter. But I'm pessimistic that AI can truly replace an individual in that setting. Extend us for sure, help with patient management for sure, but will it ever actually take the place of the human contact? I hope not. I don't think so, but that might just be wishful thinking on my part.
AI is getting good at mimicking empathy.
It
People
is.
are comfortable speaking to them.
I talked about a study that showed how people were even more willing to divulge things to an AI that they wouldn't tell an actual human being, and how that was potentially even a benefit, because the more honest information you get from a patient, in theory, the better job you can do taking care of them. If the patient feels cared for, if the patient has the outcome that they hope for, and if they don't care that it wasn't an actual human being, an actual sentient, breathing mammal, then I guess it's not up to me to judge it. It's not up to me to say it's not okay, right? So that just might be because I'm the old guy telling kids to get off my lawn now.
So with the rise of the internet and social media, online information has evolved into a resource and a challenge for medical professionals. How has WebMD, medical TikTok, and the internet impacted the way that you do patient care?
Just do a Google search of whatever you want to search. And the first hits that come up aren't necessarily the best references or the most accurate references. They're algorithmically plotted to be the first things that come up, and sometimes paid to be the first things that come up. So I always counsel patients, hey, it's okay to look this stuff up online, but you want to go to trusted sites. Well, how do you know it's a trusted site? Well, typically sites that end in .gov, like the NIH, .edu, which are educational institutions, major universities. That's going to be reliable information. This is being put up by experts. It's vetted. You go to .coms, forget it. Any .com is selling you something, so I would never go there for medical advice. You have to be careful with some .orgs because there's usually a bias to the organization, so you need to understand that when you're reading it. And you need to be able to discriminate what is opinion versus what is practice. You have to be able to know the source, you have to be able to vet the source, and that can be really hard to do, but it's not hard to do when it's published literature, when it's been repeated over and over and again, when every major recognized medical authority says this is the way to do it, until it changes, right? So everything I just said, the caveat is it's all subject to change, right? Science is about evolution. Science is about this is what we think, we've proved it as best we can, and we're going to keep trying to disprove it, and then if we do disprove it, then we have to change, right? So things changing in medicine is just like things change in science. Our understanding of the world changes all the time because we get new information, we learn, we evolve. Well, medicine's the same thing, we change. I get asked all the time about like homeopathic medicine or Eastern medicine. I say hey, a lot of what, quote, Western medicine does is based on that, is based on naturopathic stuff, medicines that come from nature, right? We have chemotherapy agents that come from the bark of the yew tree, right? A drug for heart rhythm, digoxin, comes from the foxglove plant, right? So Western medicine isn't like some laboratory created, disconnected from nature kind of thing. So are there things in Eastern medicine that work? Absolutely. Do we understand all of them? No. Have they all been tested by what we would consider rigorous Western methods? No, not necessarily. It doesn't mean they don't work. So I don't disparage people. I don't devalue their beliefs. But what I tell them is what I know. I say, these are things that have evidence. These are things that don't. If you're doing this, there's no evidence for it, but if it's working for you, then it's working for you, right? So respecting their beliefs, but also at the same time, not feeding into a false belief that something is going to work when there's no evidence that it will.
What's the biggest healthcare challenge that modern people are facing, and what can people do to prevent it?
I think we need to focus on the things that are making us unhealthy in the first place, right? So we are increasingly unhealthy in this country. We are increasingly obese. We are increasingly diabetic. And we look for easy fixes, whether it's Ozempic injections or it's bypass surgery. We vape. We smoke less, but we vape more. We have an entire corporate structure that is designed to sell us addictive foods and maximize profit rather than giving us what's actually healthy for us, right? You know, if we were completely honest, we would do away with all fast food. We would do away with all soda pop, processed foods. Everybody would eat a healthier, balanced, raw diet, and you know, whether that's vegetarian or vegan, you can argue, but where meat's not the main part of the meal, where we treat our animals humanely, where we grow our crops and our animals without tons of pesticides and chemicals and hormones and antibiotics. It would take an entire paradigm shift of how humans look at their society and their interaction with their planet to fix that. So I can't fix any of that as a lowly general surgeon in Sacramento, California. What area of medicine could you make the biggest difference? Help the most people? It would be in preventative medicine, epidemiology. And in this country, it's diet. It's diet, it's chemical exposure in the environment, it's decreasing physical activity. That is what's making people in this country sick.
So what does the future of medicine look like to you?
The competing priorities of trying to take care of 340 million people, or whatever the population of this country is now. California is around 30 million, and be able to actually keep them healthy. And if it's ever going to actually happen, it's going to happen because of prevention. The hardest thing for any human being to change is their behaviors, right? So when you have a full-grown adult who's been doing something their whole life, getting them to radically change how they do it, or even just incrementally make small changes, is really hard. So the key is to never let them get the behaviors in the first place, which means you have to focus on kids. You have to focus on teaching children the importance of good nutrition, keeping them from developing bad habits. You know, you always hear politicians, the children are our future, right? But who's the lowest paid physician specialties in this country are pediatricians, who take care of children, and psychiatrists. Lowest paid teachers are elementary school, preschool teachers. Lowest paid daycare workers are child care workers, right? If children really are our future, and that's what we care about, why isn't that reflected by that's where the money gets spent? Think about, is there any change that I can make? Even if it's small change, is there something I can do differently? And maybe you don't think it makes a big difference, a drop of water in the ocean, but if everybody makes a little change, maybe eventually it does. Maybe the change you make influences your children, and they make even more change later. Maybe their children make even more changes. So maybe generations from now, things are better.
Thank you, Dr. Herr, for a fun and insightful conversation. As someone who has yet to find her place in the world, I feel very privileged to speak with someone who has found their passion and is willing to share their experiences with me.
It's been my pleasure. I think anybody who has the opportunity to kind of have this kind of an experience, if they're interested in going into a certain field, and actually this kind of harkens back to your mission statement with the nonprofit about intergenerational learning, and the idea that people who have experience sharing with people who don't, and either inspiring them to pursue something or making them realize that they want to go this direction rather than that direction, but this communication, this sharing of knowledge, I think it's incredibly important. I think it's the best way to learn, actually, and I think that anybody who's in a position of experience has a little bit of a responsibility to share it. And that's why I'm always happy to do this, because I think that if other people can benefit from what I went through and what I've experienced, then I think it's my duty to share that.
Yeah, it's definitely really appreciated.
Oh, you're welcome.
I've learned so much from running around the hospital
Yeah.
with you and have grown tremendously in knowledge, life, and perspective.
Yeah.
As we come to a close on this conversation, I wanted you to be the first one to know that I've officially decided to try and pursue medicine.
Oh, all right. Okay. Congratulations.
I want to become a doctor and make a difference in patients' lives like you have done for my family and for so many people. Dr. Herr, thank you for giving me the opportunity to be your shadow and interview you today. I'm going to miss this workplace so much, and I wish...
Something tells me at some point you'll be back.
Maybe in a different position.
Maybe. You never know, right?
Yeah, that would be really full circle.
That would be great. It would be the circle of life. Good. Okay.
Thank you so much, Dr.
Yeah, thank you.
It's been
I
a
appreciate
pleasure.
it. Absolutely. All my pleasure.
Remember to like and subscribe if you like this video, if you want more content like this, and let us know your thoughts in the comments below about what questions you want answered about the field of medicine.